Hi there, my name's Anna and you're listening to 1kWith, Kaleidoscope's latest venture, a series of 1,000-second conversations with a range of interesting people across health and care. In case you don't know, Kaleidoscope is a social enterprise that was set up to bring people together to improve health and care, and lots of our work focuses on starting conversations and talking about what's important. So this has led us to 1kWith, and we're delighted to be joined by Bob Klaber today, paediatrician and deputy medical director at Imperial. And to fill our 1,000-second opportunity with Bob, we've asked him to think of 3 defining moments throughout his life which have brought him to where he is today. We'll also be asking a number of surprise questions from this bowl in front of me, but more on those later. So over to you, Bob, for your introduction and first defining moment, if that's all right.
Okay, what a conundrum. I was trying to work out whether I had 0 defining moments or a few hundred. I think I'm going to go back to sort of late-ish school days. Okay. And I guess as a paediatrician, it was probably when I was about 15, 16, 17 that I worked out I wanted to look after children. Right. I think I was pretty certain I wanted to be a doctor. I had a pretty medical family and had a good sense of what that was all about. And I got involved in helping run holidays in my summer holidays for kids from London who'd never been out of London, never been to the countryside before. So that was full of sport, full of lots of mucking around. Learn how to get children very busy from very early in the morning to very late in the day to completely exhaust them so they'd sleep. But I think above all sort of taught me that I could learn a huge amount from children. I got energy from being with them, and so I think that was probably the moment where I worked out that I was likely to want to become a paediatrician. And then I went on to med school and loved the paediatric bit, and that was all all good from there. Now look where I am. Yeah,
worked out well. Never going back now.
Never going back. No,
That's impressive that you weren't. So was it kind of exhaustion mixed with
yeah, I think that's right. It was the idea that you put a lot into kids and to helping them and supporting them, and I just love their humor. I found them just brilliantly funny. Kept one on one's toes, the curiosity as well. I think it's that thing about learning as well, and if medicine's about learning, kids have got that brilliant curiosity and they take stuff at face value so much. I think us adults get a bit complicated, and so I love their sort of straightforwardness, which was really good.
Nice. So lots of lessons to be learned there.
Lots of lessons that continues.
And was there ever a moment kind of later in your medical career where you thought, no, paediatrics isn't for me, or is it always?
No, I really have loved it. I think I love the generalism of it as well. So if I wasn't a paediatrician, I'd be a geriatrician.
Okay,
I think, and the families and the sort of holistic nature of it. So no, I think I don't think I could see myself doing anything else.
Fascinating. Thank you. Let's go for our first surprise question. Could you pick one out for me, please? Thank you.
Oh, okay, there you go.
Well, I think we've sort of answered this. Well, actually, no. You've said another specialty, so this still stands. Okay. The question is, if you weren't a doctor, what would you be?
So I think the honest answer, I love to have sort of wild dream. I love my sport, so all sorts of crazy dreams of being in the Olympics and all of that stuff. But the straight answer to the question is I'd be a teacher.
Okay. Why
I think really definitely. I absolutely love teaching. I guess I'm really interested in people learning and how do you facilitate and enable that. I reckon a sort of late primary school teacher, so the sort of year 4, 5, 6 would be my absolute most fun time around it. I think I'd want to keep on lots of different subjects. Keep that generalism. I really like how if you get it right, kids can really support each other to learn. I'm really fascinated how the kids of today are using social media to learn in a very different way to we did. So definitely, I still, the teacher would be the clear-cut answer.
Oh, brilliant. And at that age, you miss out on all the GCSE.
Exactly. It's all fun. It's all fun. It's not what my kids tell me.
Oh, really?
It's very serious.
Sure.
It's very serious, but yeah, no, it feels like it's a great time of not too many worries and lots to get excited about.
Yeah. And what would you say, you were kind of mentioning that you enjoy teaching, what's your favourite teaching moment been?
My favourite teaching moment, I have to say I really enjoy teaching the non-clinical stuff. Okay. So particularly stuff about how teams work, how people interact with each other. So I guess things that we've done that have been very interactive, done some interesting stuff around simulation where you work with actors to act out different scenarios. So some of those might be clinical, but they might be in a sort of relational setting about how teams work. So yeah, and I guess I also really believe that we all continue learning. I mean, the more of this I do, the more I realise how little I know. So, you know, the idea, we have this bizarre thing in medicine, you know, you spend all your time as a junior doctor for a decade, and then over a weekend, this amazing metamorphosis happens and you become this uber consultant and you don't need to learn a thing.
Oh, is that how it happens?
Well, it didn't happen to me that way. So I think, you know, we're a bit odd about that. And I've certainly, you know, in the 10 years of being a consultant, learned more in those 10 years than probably any decade in my life. So yeah, all the sort of continuous learning and the continuous curiosity. I hope when I'm 90, I'll still have that.
Yeah, taking up a new hobby maybe.
Yeah, maybe being a teacher, who knows.
Second grade. Great, can we have your second moment?
Yes, well, I think my second moment probably took me to university days, and so I was lucky enough to spend 3 years in Cambridge, and I went quite off-piste in my third year and did a year of social and political sciences, which got me into all sorts of fun and games, and I guess a bit of an understanding about politics and policy and stuff around psychology, and then I moved from there down to the London Hospital in Whitechapel, which I absolutely adore, and I really fell in love with East End and the people there. And I guess it sort of really, at a time, they were my first years of learning clinical medicine, in and amongst an amazing population and people with a real sense of kindness and culture, and you know, it's got a great history in the East End of that. And so I learned a lot of medicine, but I think I learned a lot about the people there. And the other dimension on that was around mentors. So that was the time, and in my early years as a junior doctor, I managed to find myself in jobs where I had some bosses who were just the most brilliant mentors, partly in terms of the sort of pediatric training that they supported and provided, but much more than that, about what healthcare is all about, what people are all about. So that, I think, was a really, really key time for me. And I also, my sort of interest in education and learning, I think, sort of came to a bit of a fore there. And Vic Larcher, who was one of my bosses, was sort of spotted in me before I did, and he sort of said, look, you should go and do more of this. I said, really? And he was absolutely right. So that was a really important time for me. I think, you know, starting life as a junior doctor, finding you love it, and you've you know, get a huge amount out of it and want to put lots in, so that was a really exciting time, and I look back on that very fondly.
Oh, brilliant. And what is it, do you think, that makes a good mentor? Kind of, what are those qualities?
Oh, great question. I think, I mean, there's something about really properly giving people time. And so sometimes there's a bit, I mean, I try and do quite a lot of it and really, really try and make myself available. I think that this sort of real depth of listening is so important. And there aren't, I think people sometimes come to you, and I'm sure I did that to my mentors, you know, you come with questions wanting answers. And actually, trying to give people some supportive space in which they can try and work stuff out themselves. The other thing that I think is helpful around it is being a connector that is useful. So I certainly, my experience of being mentored, and indeed being a mentor, is really trying to connect people up with other conversations. Because I guess if you believe, you know, my sort of theory of change on how we need to move healthcare forward is it's about connections and relationships. And so really encouraging people to go and be curious, go and explore, go and talk to other people. So I think a good mentoring conversation should lead to 3 or 4 other ones, would be a nice measure to have in up. I know you guys, you like measures.
Absolutely, got to evaluate these things.
Exactly.
Brilliant, thank you, Bob. Could you pick a second surprise question, please?
There you go.
Thank you very much. Oh, that's a blank one.
Blank one. I don't know how so what's that? Do I just get to, you know,
just
create?
The camera inside.
There you go.
Thank you. Sorry about that. So, in your opinion, what life skills are rarely taught but extremely useful?
Ooh. Okay. Well, something I've okay, 2 things to go on here. Something I've mentioned, one thing I've mentioned already, one thing I haven't. So I've touched on the word curiosity quite a bit. I think that's really, really important. Now, whether you need to teach it, because if you follow my argument from earlier, I think children have it brilliantly. And then something weird happens in adulthood. It's a bit like that registrar to consultant change. People sort of lose that, or the construct of work, or the construct of being an adult seems to make it much harder for people to stay curious. So I think that it's probably not a sort of teaching thing, it's a sort of coaching and nurturing type piece.
Keeping it there.
Yeah, keeping it there, and taking people back to that stuff and encouraging people. I mean, there's the sort of cliched phrases of thinking outside the box and all of those sort of things, which perhaps aren't helpful, but constantly being curious, curious about why things happen, why things don't happen, why people behave in different ways. So I think there's a piece on that. And then the other really big one that I think is going to become more and more and more of an issue for us in healthcare is around uncertainty.
Okay.
So I would be, well, I think we've perhaps had a few decades where things have seemed to be getting more and more clear and more certain, and more diagnostics will tell you what's going on. I think the more I get into healthcare, the more I realise the most interesting bits, the most complicated bits, are by definition where there's uncertainty. The hardest conversations I have with parents are around uncertainty. So people cope, you can tell them the most terrible diagnosis, and their capability and capacity to cope with that is extraordinary and is totally humbling. Where you describe to people that that's a possibility, but it's also possible they'll be fine, and this is possible, and it's all really uncertain, a complete meltdown, and find that really, really hard. So I think how we cope with that, I think how we cope with uncertainty as staff working is really, really difficult, and that sort of ambiguity of things. And if you think about things like the world of genomics that's coming our way, that's going to create a whole level of new stuff. So you're going to find out that you or your child has got, some A27X.2 genetic story. What does that mean? Well, we won't know, and we may not know for a good while, and it's really important direction for us. But so I think the uncertainty piece is going to be really, really key. How do you teach people that? So I'm really looking forward to seeing our medical schools and our nursing universities that teach nursing and grapple with that one. Yeah. So that's sort of some of the stuff that I enjoy certainly talking to medical students about. They come to me to learn paediatrics, they get absolutely none of that. Conversations about uncertainty and curiosity.
More interesting, Bob.
Well, I don't know. I don't think that helps them with their exams, which causes some upset.
Maybe the exams will meet
exactly.
These kind of questions. Do you think you're good at dealing with uncertainty?
On a learning curve of dealing with uncertainty. Yeah, I have to say I enjoy it. 20 years into being a doctor, it's the most sort of stimulating bit in a way. It's sort of diagnostically stimulating, but for me it's that relational piece. So how can you support people through uncertainty in a way that's kind and constructive and forward looking, but doesn't have answers? You're just sort of holding that space for it. It is a challenge, but a challenge that has real meaning. So so I don't know, okay,
mark yourself out of 10.
4 and on the up. I hope.
Brilliant, thank you. And then your third and final defining moment, please.
Yeah, this was a hard one really about things, and there were two angles. The one that I'm not going to do is around this idea of, in a sense, of a sort of social movement of people. So this amazing school of paediatrics I'm part of was that one, but I'm just going to put that out there as a teaser. That's not the one I'm mentioning, but that's been really powerful and has taught me a lot. I think the one that I'll talk a little bit about is about the work that I took on. So around 4 years ago, I'd been a paediatrician at Imperial for about 5 or 6 years, and I sort of just got involved in some work around values and behaviours, because I felt that as an organisation we weren't really paying enough attention to that. And with a few colleagues, we were part of a leadership development programme, and we sort of had to do, I don't know if we even had to do some project, but we really sort of coalesced around this idea and got quite passionate about it. And a new chief exec arrived midway through our time there, who's an amazing lady called Tracy Batten, and we essentially wrapped up, it's a kaleidoscope style trick. You get all of your flip charts that you've done with your crazy ideas, sort of wrap them up in a ribbon and presented it as a welcoming present. And we went to see Tracy and had a really good conversation about values and behaviours, and her playback to us was, this is the most key thing that we need to do in the organisation, and far better it's staff led than CEO led, so go for it. So we did a whole load of work. We went out to about 2,000 people. So in some ways, wow, amazing, 2,000 people. In other ways, that's about, I don't know what it was at the time, 18% of the staff. So a good start would be what I call. But we really asked the question, that question that's emerged as being a big, what are the things that matter to you as staff? What's important here? And did some really nice work around it. And off the back of that, we started to think, well, great, you've got a set of co-designed values, which were kind, expert, collaborative, and aspirational. And aspirational being very much about sort of learning and discover and do and improve. And we tried to sort of think, well, what could we do that would really help cement that into reality? And so off the back of that, set up a quality improvement program. So essentially, I was asked to apply for a job, which was a 2-day a week, essentially sort of sabbatical based out in the medical director's office, with the task of creating a culture of continuous improvement. So I was given a blank sheet of paper, bucket loads of support from chief exec and medical director and others, and a real sense. So I went around the country and got in touch around the world about who's done this in really interesting and bold ways. I was really convinced we needed to do the work ourselves. So we'd probably had a bad record of getting in consultancy firms to come and do stuff for us, not commissioning it very well. It doesn't land, it upsets people, it's just a disaster. So I knew we needed to do the work ourselves. We created this, but be totally stupid not to get all the best ideas from around the place. So we got loads of fantastic ideas and thoughts. So guys up at Salford and Sheffield and East London, and linked up with the guys in the IHI, and also the sorts of things you all up to, so all sorts of interesting stuff, and pulled it together to create a program that's all about creating a culture of continuous improvement. A memorable trip to the board that was to sort of describe this, where I told them it was a 20-year program. Wow. Which I suspect they don't hear. Well, I'm, obviously very young and will be there to see it through. Right. So I think that's important as well. They do too much stuff thinking about in-year. So yeah, so that would be my third defining moment. That's been a lot of fun. Fantastic. And I mean, how did that land, that conversation of this is a 20-year kind of plan? Very seriously, because I was really serious about it. And as somebody who's, prone to being a bit fun about stuff and things, I was really, really serious. I think it landed really well. I was, in a way, I think, boards need to make choices about stuff that's real, and our role as staff is to be very honest and open about stuff. I have no real problems being straight and honest with people. To go into that thinking you could patch it up in a couple of year program would be absolute madness. So I was very clear. And I think one of the great privileges we have as doctors is, we grow roots in places, and that has its disadvantages around change, but that sort of constancy of purpose and is really, really clear. And single clear aim, create a culture of continuous improvement. You can't do that in 2 years. But going at it with that, just the 20 years is not trying to hide from the reality. We can absolutely achieve stuff and really important milestones along the way, but the idea that you can do that stuff overnight is crazy, and I needed to be really clear. So I don't think it's what they usually hear, but we've got to be clear with people. Absolutely. And do you think if you left tomorrow, would it carry on? So actually, interestingly, the succession planning bit of it is really, so I'm in a slightly different role. We talk about job titles are irrelevant, but interestingly, the running of the team there. So 2 wonderful colleagues, a brilliant example of fantastic example of leadership for the modern world. So Fran Clough and Dominique Allwood, fantastic female leaders in a job share, in a traditional, they're associate medical directors. That's a sort of traditional grey white man job, if ever I've heard one. And they're absolutely fantastic and are taking the work on to levels that I wouldn't have achieved. So it's really exciting. Positive. Thank you, Bob. Time for the final surprise question. Okay. If you could pick one out. There's no more blanks, I promise. Sure. I'm worried what else you put in there. Our final surprise question is, what are you interested in that most people aren't? That's it. Like my not very exciting life. I've got quite into, I have 3 lovely children who were going to be, in a way, could have been my 3 defining moments in lots of ways. But between us and them, we've got quite into paddleboarding. Okay. Nice. So stand up paddleboarding. And when I first saw it, I sort of thought it's absolutely ridiculous. And I'm 6'3" and I'm a sportsman, but a ball sportsman. And tennis and rugby and football. It's a bit different. And when you first stand up on these things, they feel absolutely ridiculous. Every muscle in your body is sort of tensed up and things. But actually, having got over that a bit, I've absolutely loved doing it. So I've even entered a couple of paddleboard races.
Oh wow!
Things like that.
In my mind, paddleboarding is kind of very relaxing and you're kind of ambling, but there's races.
Yeah. Well, I don't know where. Okay. Slightly sort of crazy races on the North Norfolk coast. Nice. But paddleboarding's been absolutely fantastic. And interestingly, I work in Paddington, right, St Mary's, right by the canal. There's quite a bit of paddleboarding there. They do free sessions on a Wednesday lunchtime if anyone wants to come along. If you're feeling, come and see us, happily meet up and you can go paddleboarding. So yeah, that's been really good, and I've loved it. There's something very special about, as you say, the calm, quiet, not the frenetic race, and you can sort of get up little creeks and places that no one else can. So that would be, I don't know, you'll tell me it's a craze and everyone's doing it, but
I've done it once or twice and have enjoyed it. But it's a good recommendation, I think.
You also get really fit trying to pump the things up.
Yeah, we've got
it's about a good 10 minutes of hard work.
Yeah. So good for your mental well-being.
Exactly. Joy in work on a paddleboard.
Ideal, yeah. I think next step is probably meetings on paddleboards.
Listen, you could do that. You absolutely could do that. Nice. I think we could do it. There's my kaleidoscope challenge for you and Rich. I want a paddleboard meeting. Okay. We'll sort it out in Paddington, yeah?
Yeah, we'll see what we can do.
Okay,
that's a lovely note to end on. That's all we have time for. Thank you so much, Bob, for joining us for this 1kWith conversation. If you'd like to catch up on this or other conversations that we've had, do head to our website, kaleidoscope.healthcare, or join the conversation on Twitter, #1kWith. Thanks very much for joining. Bye-bye.